and I'm chair of this group, which is the Contra Costa Transportation Authority Paratransit Council. And we'll start out, I'm going to read some information about how we conduct the Zoom meeting, and then we'll go on to the regular agenda. So due to the shelter in place and COVID-19, the Paratransit Coordinating Council has chosen Zoom as its meeting platform. During this meeting, please mute your mic. If you haven't already done so, please mute your mic now. So on I happen to have an iPad that I'm using, and if you go to the top of the screen on the right and tap it, you'll see that one of the things is mute. So you would just tap that and until you get a red, no, until it's already muted. Looks like, okay. And then if you have a different device, I'm not sure how to do it. Fifi, do you know?
I'm sorry?
Do you know how to unmute on a computer?
You can either click on the mute unmute microphone, or you can press on your tab button.
Okay, and on a phone, it's *6?
It's *9.
*9, okay.
Mhm.
And that should encompass everything then, right? I think so.
Yes.
Here are the Zoom meeting instructions. I will request any committee questions and comments on an agenda item. If you would like to speak, please physically raise your hand. My picture seems to have disappeared for some reason. I was gonna show how I was gonna, are you there?
I'm here.
Okay, my screen just froze, I think. Don't know what to do about it. You can hear me though?
We can hear you.
Okay, because my screen is not working right now. So physically raise your hand, and authority staff or I will call upon you. Please unmute your mic. After you speak, please remute your mic. It's the same button or the same set of like *9, either to mute or to unmute. It just changes it. I will request any public comment. If anyone from the public attending the meeting wishes to speak during an agenda item, please raise your hand or press *9 if you're on the phone. Fifi or I will call upon you to speak and unmute your mic. You will have 3 minutes to speak. After 3 minutes, your mic will be automatically remuted. Aha. And your hand will be lowered. If an action is required on an agenda item, the chair will call for the vote. Fifi will conduct a roll call vote on all items, right?
Yes, ma'am.
When Fifi calls upon you, unmute your mic, state your vote. So it'd be like yes, no, or abstain, and then remute your mic. The first item on the agenda is the Pledge of Allegiance. Rashida, would you like to lead us in the pledge?
I'm sorry, Janet. I don't pledge.
Oh, okay, that's okay. Who's a fellow?
Sherry Abelson, I'd be happy to.
Yes,
Okay,
I'll lead.
Okay,
Hello.
there we go.
I pledge allegiance
To the flag
to the flag of the United States
of
of America and to the republic
for which it
which stands, one nation, under God, indivisible, with liberty
and
and justice for all.
Thank you, Paula.
Okay. And Fifi, would you now take the roll call, please?
Yes. Give me just 1 second. Okay. Charlie Anderson. Mary Bruns.
Mary's here. She's on mute.
Okay.
I'm here.
Hi, Peter.
Okay. Let's just change that. Okay. Jean Clark.
Here.
Bridget Cooney.
Here.
Hi.
Thank you. Lisa Hammond.
Here.
Vi Ibarra.
Good afternoon, I'm here.
Rashida Kamara.
Here.
Kim Ridgway. No Kim. Deanna Perry.
Here.
Lori Reese Brown.
Here.
Pello Smith.
Here.
Laura Timothy. Vice Chair Dajali.
Hmm.
Chair Abelson.
Here.
Okay. Attendance is complete. Chair Abelson, please note that Committee Member Anderson, Committee Member Ridgway, Committee Member Timothy, and Vice Chair Dowjali are all absent.
Okay, thank you. But we do have a quorum, right?
Yes.
Thank you. Okay, the next item on the agenda is item number D, public comment. And members of the public are invited to address the council regarding any item that is not on the agenda. Please refer to the COVID-19 special notice for public comment guidelines. The next item on the agenda, let's see, this actually, I think I'm having a little trouble reading this. Let's see. The next item. No. So
Chair
I think
Abelson,
the next thing I need to say is, are there any members of the public who would like to make a comment on something that is not on the agenda? Am I right there?
Yes. And
Okay.
I'd like to let you know that I did not receive any comment cards from the public.
Okay, so that item then is closed. And second. Okay, the next item on the agenda is the approval of summary of actions from May 18th, 2020. And I'd like to ask now, are there any changes, comments, etc. from the committee? And if so, please raise your hand. If anyone from the public would like to speak, please raise your hand. Are there any comments from anyone? Okay, are we ready to have a motion? So somebody on the committee would like to make a motion
Jean Clark.
about, pardon?
I just wanted to, on the, so sorry, we had the Contra Costa PCC membership roster.
Mhm.
And what was attached, the changes still haven't been made for San Pablo. The two people listed no longer work with the agency. And I believe Peter and I had made that adjustment verbally at the last meeting.
I will make note of that. Thank you, Committee Member Clark.
Sure. So it should be me, and the alternative would be Maria
Yes.
Garcia. Great. Thank you.
Okay, and with that, would you like to make a motion to approve that with the changes that you made just now? You need to say it. Oh,
Look,
sorry.
yes, I'd make a motion to approve the actions with the changes that were just mentioned.
Thank you. Is there a second?
I'll second.
Thank you. With that, we are ready to take roll call vote, please.
Okay. Committee Member Bruns, how do you vote?
Aye. Yes.
Yes. Okay. Jean, Committee Member Clark?
Yes.
Committee Member Hammond,
Yes.
Committee Member Cooney, Committee Member Cooney, how do you vote?
Yes.
Thank you. Committee Member Ibarra,
Yes.
Committee Member Kamara,
Yes.
Committee Member Perry,
Yes.
Committee Member Reese Brown,
Yes.
Committee Member Smith,
Yes.
Chair Abelson.
Yes,
Okay, motion passes unanimously by all members present.
thank you. Now we'll move on to item number 2, which is the consent calendar, which is items number 1, the PCC membership roster, which is the one attached today. And then 2 is the upcoming meeting calendar, which is also attached in your packet. Or at least it should be. I have kind of 2 packets, so I'm looking to see if I got it. Are there any corrections or is there a motion?
I think we need to correct the membership roster that was pointed out earlier by Gene Clark.
Okay, it's the same correction.
Yeah, other than that, these are informational items, so we don't need to vote.
Okay, so then we'll just move on to the following. If there was do we need to vote because there was a correction?
No, I think we noted the correction already. We'll take care of it.
Oh, okay. Okay, so now we're ready for the regular agenda items. And the next item is the expiration of member terms. Currently, 3 members' terms are expiring. Lisa Hammond, Bai Ibarra, and Othello Smith. Will the committee members confirm that they are or are not interested in serving another 2 years? We should do this one at a time. Fifi, would you call their names and get their yes for they want to continue and no that they don't?
Sure. Committee Member Hammond, are you interested in serving another 2 years on the PCC?
Lisa, you're on mute.
I'll move on to the next person. Committee Member Ibarra, are you interested
Sorry,
in continuing
yes.
your
That was a yes for
your
me.
membership on the PCC?
Was that yes from Lisa or from,
That was from Lisa.
that was, okay, so Lisa now said, okay.
Thank you, Lisa. And Vi, yes?
Yes, if you'll
Yeah,
have me,
Committee
I'm
Member
happy to
Ibarra.
remain.
And Mr. Pello Smith, are you interested in continuing your membership as well?
Yes.
Okay, so Chair Abelson, all 3 members do want to continue their membership on the PCC for another 2 years. So we just need a motion and a second and a vote.
Okay. And are there any other, I have a note, are there, to ask if there are any other comments from the committee? If so, you need to raise your hand or press *9. And if the public would like to speak, please raise your hand. Are there any hands raised?
I don't see any public comment.
Not hearing any, then we'll go on to a vote. So we need a motion, right? Somebody like to make a motion to accept the 3 parties extending their terms? You have to, if you're gonna want to make a motion, you need to raise your hand first.
Committee Member Ibarra is raising her, I'm sorry, Kamara is raising her hand.
Okay,
I make a motion that we accept that we extend their terms for another 2 years.
okay, thank you. And is there a second to that motion?
I second that.
That was
Deanna.
Deanna, okay. I don't have pictures for some reason on my screen. I can't tell from a picture who you are. Okay, then we're ready for a roll call vote.
Okay. When I call your name, please state your vote. Committee Member Bruns,
Yes.
Committee Member Clark,
Yes.
Committee Member Cooney,
Yes.
Committee Member Hammond,
Yes.
Committee Member Ibarra,
Yes.
Committee Member Kamara,
Yes.
Committee Member Perry,
Yes.
Committee Member Reese Brown,
Yes.
Committee Member Smith,
Yes.
and Chair Abelson.
Yes,
Okay, motion passes unanimously by all members present.
thank you, and congratulations to the 3 continuing members. The
Madam-
next item, go
Madam
ahead.
Chair.
Yes,
Continuing on this item, we do need to point out that there's a large number of vacancies still in the PCC. So as always, we would like, members to see if they can recruit new members to the PCC. We're looking to fill 2 writer consumer positions in West County, 3 in Central County, and 1 in East County. Paratransit service agency, there are 3 agency vacancies, so we need to work on some agency vacancies.
those have to come from within the agency though, right?
Yeah, somebody within a particular agency.
And those 3 are what?
No, those agencies are vacant. So,
Oh, I mean, what are the names of the agencies so that if,
well, it's any agency. So any agency that serves clients that are either seniors or disabled are eligible to participate.
oh, I thought you meant it was the like AC Transit or BART or something like that.
Yeah.
You mean the other group,
Social
okay.
service agencies, yeah.
Social serve, okay.
And then what we would ask you to do, Madam Chair, is to appoint a subcommittee to review any applications that we receive.
Okay, so we can do that right now. So to do that, I'd just like to ask who would like to be on it. I'll be on it, and raise your hand if you would also like to be on it, and Fifi will call your name, so we'll all know that you raised your hand.
Rashid is raising her hand on the video, and so is Vayabara.
Okay.
I'm sorry, I was doing something else. I didn't hear what this is for.
This is for being on a committee to review applications for PCC membership of vacant positions.
Oh, I'd love to be there.
Okay, anybody else?
Gene, I saw you raise your hand. Do you want to?
Sorry, there's a delay when I hit unmute. And so
Oh.
then I hit it again and anyway. So yeah, there's already 3, but I didn't know how many more you wanted, so.
Well, it has to be less than a majority of the members on the committee. So people are interested. I mean, that's the,
Peter, you had
limitation.
said 3.
Yeah, that's 4. So that
Was
are
we
plenty.
have,
We're okay with 5.
okay. We could use 1 more.
we
And
don't
who was
have
that
to.
last? Clark.
We could, Gene, you can be on there if you're interested. We can do 5. Okay, she's nodding yes.
Okay, thank you, everybody, for volunteering. Normally, what we do is we have the group meet about a half an hour or so, depending on how many candidates there would be before the meeting starts, the PCC meeting, so that you wouldn't have to make a separate arrangement, although at the moment we don't really have to go anyplace extra anyway. But so that takes care of that. And the next item is item number 2 on the regular agenda, which is an update on the status of accessible transportation, strategic, otherwise known as ATS plan. And thank you. Are there any comments from the committee? If so, raise your hand or press *9 if you're on a phone. If anyone from the public would like to speak, please raise your hand. If there is no further discussion, we will move on to the next item on the agenda.
Janet,
Yeah, why am I'm a little confused. I'm following the script, but so are you somebody gonna discuss it first?
I was going to provide a little update as to the study.
Okay, thank
And
you.
John Cunningham is also available here. He's with Contra Costa County, and the county is partners with us as part of this study. So we have really, I think, found some traction in the public outreach phase. Even with COVID-19, we've been able to reach out and get over 800, close to 900 surveys back from people who use different transportation. Well, actually just seniors and disabled folks in general, providing comments on transportation issues they've been having. We have a pretty good geographic spread. We've been looking at that from where we are receiving the applications. I'd say if we were light anywhere, it would be in West County. But we still have received a fairly significant amount from West County as well. We've received surveys in 3 languages, English, Spanish, and Mandarin, which is good. And we have been conducted at least 1, maybe 2 by now, focus groups that were set up, and have some more of those scheduled. So we're planning on keeping the survey open until the end of this month, and then we will continue after that with some focus groups that we can get scheduled. What we're doing, what we had originally planned is to do meetings set up by community-based organizations, and that we would provide a stipend to those organizations to help draw in people, whether it's provide food, cookies, coffee, stuff like that. Since we haven't been able to do that, what we're doing is these focus groups in which we're providing a stipend to the organization that sets up the focus group for us. And the focus, in that case, they're Zoom meetings. And either the organization can do whatever with the funds they want. They can keep it for their own program, or they can provide it to the participants in the that participate in the focus group. So the TAC has met on several occasions, I think two or three occasions, I think 2 live, and we've Zoomed twice. And we've been doing outreach. We've canceled the last couple meetings, but it's just because of everybody was kind of focused. We've been trying to be very sensitive to people's time during this recovery period. So we didn't take a lot of time. And with the outreach going as well as it has, we've kind of counted on continuing to use our time doing outreach. We are in the process of scheduling the first policy advisory committee meeting. So we're finalizing a date on that, or I think we finalized the date. And we're going to provide some outreach material to those PAC members. John, is there anything I've missed or that you want to include? I'm sure I've missed something.
No, I think you covered where we are pretty well, Peter. I guess, I don't know if you mentioned this, but the study is scheduled to end in the fall or by the end of the year at the latest, I think.
Yeah, so the current status is Nelson Nygaard is still doing outreach to the current operators to get some statistical information. They're going to come up with a series of recommendations, and there's going to be another series of outreach to the public about potential strategies. And then the final document will be prepared to go out for adoption. So there's still quite a bit of work that needs to be done. We're still looking at a end of the year, late fall or end of the year completion as far as the draft, and then early next year would be adoption by the any of the governing bodies. So we'll just keep you informed at our next meeting as to the status.
So I have a question, Peter.
Okay.
The question I had was, had to do with COVID-19, actually. And so when one would do a study, one would assume the study was done assuming that there was no COVID-19. But so there's a set of principles or rules or whatever you want to call them overseeing that project. And the question I had is, now we know there can be such a thing as COVID-19 and that it disrupts that schedule. Are you looking at how that would impact this report?
Well, we had brought that up. We brought that up in one of our TAC meetings that had the Caltrans, which is providing us the money for the study, and they weren't ready at that point to look at an extension of the project. So I think that gets to what you're saying. So we kind of brought it up. We were kind of told, you know, we're not at a point where we need to make that decision yet. So it appears that the fact that we've been able to gather a lot of input to this point is good. If we do run into a roadblock, we will go back to Caltrans and you know, keep them up to date as what the status is.
So what I'm thinking about are situations like where, say, an agency has been providing rides to people in paratransit vehicles. Now what they're doing is they're bringing goods to the person's home in the paratransit vehicle.
Yeah.
And so would the report will not cover the topics like that? Would it just be assumed that in a pandemic situation that the rules are set aside to a certain extent?
So the information that's being collected during this period, we're collecting both current concerns as well as pre-COVID concerns or issues regarding transportation. So of course, we're still in the process of collecting the information, so nothing has been looked at yet as far as, you know, what fully is being heard. But we certainly will look from a strategic perspective at post-COVID services that are being provided and their effectiveness, and certainly their effectiveness should this, you know, a COVID or some other pandemic occur that would cause for people to shelter in place, and that the vehicles continue to be productive in other ways, which is what they're doing now with.
For the same people even, right? Maybe?
Correct. For the same people, yeah. Yeah, for seniors and disabled populations, for the people that are being served. So yeah, I think in a way, the study going on right now, you know, if the study was complete before COVID, we wouldn't have been able to capture kind of these extra this shift in services that has occurred. So I think in a way it's good that we're able to see how operators are still able to keep their vehicles on the road and provide services. They're not moving people, but they're moving, you know, food and medicine and other medical supplies and equipment. So I think it's good timing. It's good, you know, I hate to say it's good timing because it's not a good situation, but at least we're learning new things.
It's appropriate timing, maybe.
Right. And I think if you're done with your questions, Janet,
I am, but maybe we should go on to somebody else and see if there's somebody else who has a question.
Rashida has a question.
Rashida?
Yes. With the 800 or so survey responses that you received back, I know that you're still getting responses back, but do you think that they're proportionally representative of individuals that use at least use some of the current existing service? As an example, there are potentially about 17,000 people in AC Transit or 18,000 people in AC Transit's database. I have about 2,700 people in my database. When you think about the individuals that are responding to the survey, if you were to divide it up to the different areas, not only the different geographic areas, but the services that are in existence in those areas. So, La Marinda also services an area that I also service. So would you expect that out of that 800, you have a appropriate amount of responses in that area so that they can speak to all spectrums of the services that they currently have in their area, or no?
Yeah, so I can answer that this way. From a service provider to service provider, the information is there in the survey. I just don't know. I just haven't seen it. So I can't tell you if, a share of County Connection Lyft folks is proportionally similar to a share of Tri-Delta Transit folks, type thing. What I can tell you is there's a good proportionate share of people who currently are in eligible and eligible clients who are participating as clients with one of your agencies, as well as people who currently do not use any of the current services. So we are getting both people who are in the system and people who are not in the system. I just don't know the breakdown of the different service providers.
Okay. And then I have a second part to that question. Being that it is COVID era, do you get any sense that, this is kind of piggybacking what Janet was asking, but do you get any sense that the responses, first of all, have you had an opportunity to actually analyze the responses? Because the first one, it may have been that we haven't collected everything yet to really analyze it. And then to follow that would be, when you do have the opportunity to analyze it, are we going to be looking at how much more dire the situation has become when it comes to transportation services as a result of COVID-19, right? Because, for instance, something that has severely impacted COVID-19 is I know that I'm personally experiencing that right now, is that when my fixed route bus goes to do a pickup, it may tell the person there that we've now reached capacity and there are only 10 people on the bus. So whereas they may not have experienced the capacity issue 7-8 months ago, right? Mm-hmm. Now, all of a sudden, they always experience a capacity issue. And whereas our frequency might have been more or less, whatever problems may have associated with that in the past may not have been so prominent, but because of COVID-19 and social distancing, it now is. Whereas services may have been all the way up till 10 p.m. Maybe services are now 7 p.m. as a result of COVID-19 because 1/3 of the driver force are above 65 and they just can't come to work because, we can't put them to work and we also can't hire to replace them, because then you're looking to hire somebody that is without a pre-existing condition less than 65, which is illegal. So we have to run the system based on what we have. So the responses that we're getting, I'm sorry, this is a really long question, but just to give you some context of what I think should be looked at in the responses, because I think that COVID-19, just when we put the surveys out, COVID-19, it's going to bear you're going to see the signs of that in the response.
Yes, I agree. So just to start, let me say we haven't done that analysis. I mean, we've seen some of the responses. There certainly hasn't been any cross tabulations or any of that type of stuff done at this point. So to get into those kind of details, at this point that the analysis just hasn't been done. I think what you're bringing up are some really interesting issues that might be better captured in the focus group discussions, because you can kind of put a time period there as you talk to people about what their issues are. I think the other interesting thing would be if there's some significant dates of maybe, you know, the phases of COVID at this point where, you know, stay-at-home orders or public health orders changed, that maybe we should identify, if we can, it's not going to be super accurate, but the dates that people potentially turned in their surveys might give us a picture of where they were at that time, and things might have changed.
It's good to note that, I'm sorry, Peter, it's good to note that even though there were the phases with the public health departments and the CDC, transit had either, they made certain decisions either slightly before or after those types of mandates. And I'll just use as an example, when a transit agency decided not to collect fare, right? Then depending on which, even though we were all trying to do this in unison, it really didn't happen in unison. One person did it first, then 5, 6, 7, then next thing you know, all 10 did it. So
Right.
depending on where that survey came or who answered that survey, they may or may not have fallen into that category. Another example would be, when did somebody start rear boarding? When did they, you know, depending on what type of vehicle it was, did they do 10? Did they do 12? Did they do 15 when it comes to social distancing? In the case of paratransit, from when they did, depending on which vehicle they had, when they were able to put 15 people in the bus versus when they were able to put only 3 people in the bus versus when they decided to put only 1 person on the bus for the purpose of social distancing. So there's some very finite, weird things that have sort of happened. Okay.
Yeah, no, I understand. I think we can, and the other thing we have to talk about is the relevance of that information to the study, which you know, if you're just looking, I mean, obviously for studying COVID and the effects that COVID has had, there's some very significant information in there, and maybe there's a whole nother way to take this data that we're getting during this period and do a whole new paper on it. But I could say we could look at, if we know where the service, you know, if a particular set of surveys came out of a particular agency's service area, then we could compare that to when that service area went to, you know, not collecting fares type thing. But you know, the number of surveys from that whole area may not be big enough to be, you know,
Just something to kind of keep in mind as we get to the analysis stage.
You're bringing up a lot of really good points from just studying this from you know, the effects of COVID on how people responded to transit and paratransit is interesting.
Okay, you finished? Is there anyone else who'd like to make a comment on this item? Okay, are the people that can I ask a final question? Are the people that are doing the survey, are they the same people who are eligible for paratransit as a group? For example, seniors are eligible, and people who are disabled and ADA certified, I think that's something like that is the criteria. Are those the people doing the survey?
You mean taking the survey, or?
Yes.
Yeah, so anybody who's senior or disabled, that's who we're getting to, that's who we're asking the survey.
But there's disabled, and then there's, I guess when I said ADA, I meant paratransit eligible. There's a difference between paratransit eligible and disabled. So I was wondering which way you were looking at it.
What we're looking at is getting feedback from seniors and people with disabilities and their transportation issues, whether it's paratransit or not. whether it's ADA.
Oh, okay, this is not a paratransit study, you're saying?
No, it's a accessible transportation study.
Okay,
Transportation
okay,
issue.
yeah, then it wouldn't matter. Okay, and I'm not hearing that there are any other questions. So this is an information item, right?
Yes, correct.
Okay, so we'll move on to the next item, which is the Measure J revenue update, which is also an information item, and it's an operator's update on current services provided during COVID-19. Operators are asked to share what services they are currently providing during the shelter in place.
Yeah,
So why don't we start with that?
Yeah, I thought for number 3, the Measure J revenue update, I thought I'd give a quick update on that first.
Okay,
And that is, so we wrapped up fiscal year 1920. We don't have the final revenue numbers in yet, but the last quarterly number that we got, which we got in March, so shelter in place, were above what we thought they would be. We had a very good holiday season from a sales tax perspective. So now it looks like we will probably be able to pay out all of, if not a high percentage of that 10% that we've got. We've been holding back, although we won't know for sure, of course, until the end of August when we get the last quarter of revenues in from the state. We are still in a wait and see on, of course, 2021, especially now that, COVID is starting to, the curve is going back up. So we don't know what effect that's going to have on the economy and on sales tax, but we have approved funding for 6 months based on a pretty significant reduction in sales tax revenue that we went through that I talked about at our last meeting when we approved the funding allocation. So just wanted to mention the part about the end of 1920 and that it was higher than we expected. Of course, that was, that number was pre shelter in place information. So we're still anticipating that revenues will be down significantly for that last quarter, but hopefully we'll at least, reach enough to pay that last 10%, we're hoping.
okay. Are there, so you're wanting you're wanting operators to give reports?
Yeah, now on more, if any of the operators just thought it would be good for everybody to hear kind of what's going on. It doesn't even have to be operators, but agencies as well that are providing services. I think it's interesting for the group to hear and share ideas on what you've been doing, what's been working, and kind of if you are starting, I guess, first of all, starting recovery plans, and second of all, vehicle safety for your own employees as well as the public. So I don't know if anybody, it looks like Lori.
I don't, Pete, does somebody raise their hand? I can't tell.
Yeah, Lori Reese Brown's raising her hand.
Yes,
Okay.
thank you. For some reason, the *9 was not working for me. But anyway, so Peter, I have one question before I go into what the city of Richmond has been doing. You said that it looks like by the end of this year or quarter 4 in 2020, looks like the Measure J funds will be significantly lower. I guess you cannot tell how much lower they would be. You think maybe 30%, 50%, 10%? What do you think that would look like?
Yeah.
I know I'm asking you now to be a fortune teller.
I can't remember the percentage, to be honest with you. The number that went to our board was, I think, about 22% lower than it. It's a 5% reduction on what we think the actuals are going to be for 1920. So I think this number won't mean anything to you, but the total sales tax for 1920 we think is going to be about 85 million. Prior to COVID, we were projecting it at 96 million. So that shows you the hit that 1920 took. And we're expecting another drop of 5 or 6% for 2021.
Okay. All right. No, those numbers are, I guess they help for now because the city does have to report out in terms of what type of services we're offering, how our services may have significantly dropped or have been reduced. So that leads me into talking about what the city of Richmond has done to date. And we've been basically have been trying to maintain status quo. We have continued service. The Lyft program is still going on. It's just that ridership has declined significantly. Where we were seeing probably maybe 90 rides in a week. This is outside of Lyft. That has dropped probably to maybe 15 to 20 rides per week. If that. Every week it varies. And I think now with the second order of a possible shelter in place or something's kind of closing, people are even more frightened, and so they're staying in. I won't be able to assess that till the end of this month to kind of get a better feel for how the ridership is going, but it has definitely declined significantly. And so what we are doing is we're just, ensuring that our patrons remain safe by, following, and our drivers, of course, by following all the rules of maintaining safety, by wearing their masks, wearing gloves when applicable, sanitizing the buses and sanitizing the area where we think some seniors may visit. We are still allowing seniors to come to City Hall should they need to, but we have a policy in place where there's so many people that we're letting in at one time. And then they're, of course, maintaining 6 feet or more distance. We are also using our community-based organizations. I think I mentioned that before, that we work with community-based organizations. At least 2 of them who were actually doing outreach, or working with outreach to reach more seniors and inform them more about our program. We're now doing more meetings, either through our neighborhood councils, where they have their virtual meetings with their respective neighborhoods, and they're informing them of, updates, a lot of city updates, and Paratransit is one of them. And so we're trying to keep them informed that way. We do also have a, staff that's working, from the offices or from home. And so there is a number that seniors can call in, and if they have any questions about, our ridership or maintaining safety, we're informing them of that as well. But we're working very closely with the community-based organizations that we are contracted out with, and they're pretty much doing a lot of the work with outreach to the community and working with the neighborhood councils.
Madam Chair, Rashida's hand is up.
Okay, Rashida, would you like to present?
Yeah, so ever since the order in place, March 16th, the first major order in place, paratransit services dropped about 80%. That week, we reached out to Meals on Wheels, and they wanted us to register our drivers as volunteers. So 39 drivers registered as volunteers. Part of the registration process meant that they wanted to assure that drivers were actually vetted with some kind of a background check, because all of their drivers do background check. The reason why this was important was because most of their drivers, their volunteer drivers, were over the age of 65 and considered high risk. So our drivers actually started doing that. Barely 2 weeks into it, we got our first scare. We had a passenger that they had informed us that had tested, but by that time we had been on these regional calls, county health department calls, and we had already started to reduce our passengers on the vehicle from 7 to 5-7 to 1. So when we got notified about that positive, when it came to contact tracing, we were able to tell them that there was nobody else on the vehicle, no other passenger on the vehicle. So the driver was the one that was on quarantine for 14 days. If we remember, there was a problem with the amount of testing kits that were available. So they set up a pre-screening situation. The driver went through the pre-screening and didn't rise to the level of having to get a test done. In the meantime, the EOC, the emergency office, reached out to the different county emergency office, reached out to the different transit agencies asking for assistance with transporting COVID positive patients and relocating members of the homeless community either to the county hospital or from the county hospital to congregate livings like hotels. Of course, we let them know that most of the transit agencies weren't able to volunteer for that. And part of the reason was that we weren't trained and there was a shortage of PPE in the nation. So the county health department says that, are you willing to do it? I said, yes, if you train us. Tri-Delta also got on board. And so, they came, they put together a training. At first they said, oh, we could train you, do train the trainer. And we were like, no, transit is our business. COVID is not our business. So the training will have to come directly from the county health department so that there are questions regarding this, we will get the real deal answers. And so they came and they gave training and they provided PPE, and we set aside some volunteer drivers. We also set aside some some dedicated vehicles, 4 to be precise. And till that date, we have been assisting the county in doing these transports of positive. And our drivers have a very specific PPEs. There's a process under which they call us. There's a process in which the vehicle gets a dispatch and the driver gets a dispatch. And there's an extensive PPE that the driver also wears in order to make this happen. In the meantime, Paratransit, we continue to do Paratransit trips. But in addition to Meals on Wheels, we've also added the Mount Diablo School District. They have about 2 schools. We deliver meals to students, up to about 200 students. San Ramon recently got on. There was a program that we did for about 6 weeks with the county, and the county collaborated with the food bank, and we did that. In the meantime, from the very beginning, when it comes to sanitizing and PPEs, we were sanitizing the vehicles twice a day. In the evening, they had a hospital grade fogger disinfectant. So the vehicles got sprayed. In the middle of the day, they would come back and they'll get sprayed again. Because we didn't have that much paratransit services, some of the drivers became cleaner. So they helped to sanitize the vehicles. The drivers were given gloves, masks, and shields, face shields, especially if they have to go ahead and break that 6 feet distance and help with securing wheelchairs. We've been putting, as each mandate happens or each information that's brought out from the CDC, updated information, then we update the information on our website, we update the information. We started doing call outs through IVR systems. We have a My Transit app, so we put information on the My Transit app. The latest, the mandates that are requiring face coverings, all of that has been pushed out for customer outreach on the website, on the app, on the IVR, where it's pushed out in calls. We've looked at our reservations process. So there's some pre-screening that we do on the reservation process, reminding people to wear their face coverings. We were able to work with Debbie Toth. Debbie and Choice in Aging actually donated some masks to us because we realized that, some people didn't have face coverings. So the drivers will each go out with about 5 extra masks so that if somebody didn't have a mask, we'll be able to give a mask to them. We're not able to do that on a grand scale, but because we started the pre-screening aspect of it, most people came prepared with their mask. And now we've been doing it now consistently for 6 weeks. So most people are now actually have that, they're taking care of that particular issue. The latest training that we had with the county And that was actually a Zoom training. And if anybody wants access to that Zoom training, I'm willing to share it. We had about 18 questions that we had asked of the county health department on what it was going to take to safely start to reintroduce regular transit protocols. You know, because how are we going to live with this? We can't live with this the way it currently is. So how do we move forward and actually live with this? And live with this means what's going to be safe when we have to start collecting fares again? What's going to be considered safe for front boarding versus rear boarding? What's going to be considered safe for somebody who says, I have a doctor, I'm exempt from wearing the mask. What does that mean? What is going to be safe? Well, how are we going to handle that? What is really going to be safe when it comes to social distancing? And we can no longer take one person because it's not sustainable to continue to just take one person. So what's really safe? So there were tons of questions that we asked. If we collect fares, how long will the virus last on the coin? How long will the virus last on the paper? Is the driver considered breaking that protocol because the driver, the person comes up to the front, that type of thing. So there were a lot of questions that were asked that were answered by the county from a safety perspective, health and safety perspective, when it comes to reopening or reinstituting some of our normal business practices as we start to live with this virus. Is one thing doing it for 3, 4, 5 months, but going on 6 months, if it's going to be sustainable, we need to figure out a way how we're going to do this by reintroducing some of our normal business practices in a safe manner. So that's one of the things that we're doing. And so as a result of that, we're starting to meet with our drivers as some of those things and practices and protocols have been deemed safe. We've been working them into our operational protocols so that we can start reintroducing some of these normal business practices into the system, but with a COVID flair.
Are you finished?
Yes.
Thank you. Any questions on that? Okay, and who's the
Actually,
next-
I think Pello Smith has a question. Did you have a question? You're on mute. He's trying to get his mute. He's on. Oh.
There he goes. Oh,
No, hand went down, but now we need your
you're
mute
on.
button.
Here, I'll take you off. I can't take you off mute either. Terry Ann.
Okay, there we go.
There we go.
Yes, Rashida, of the 4 vehicles that you guys have designated, I believe, for COVID, and am I to understand that they've been operable for 6 weeks? Does the 6 weeks apply to those vehicles in the program?
I think the first time we did this was April 11th. So they're dedicated specific for this. In other words, they're not put as part of the regular fleet for regular, general paratransit transportation. Those 4 drivers know that these are their 4 vehicles that are set aside. These are the only 4 vehicles that are used for that. And we've been doing it since April 7th, I think.
I guess then, and my question is then, over that period of time, I guess what's that, 3 months now? How many have you been able to determine how many rides per month each vehicle have been able to make?
I don't know about each vehicle, not off the top of my head, because we are doing it. She has them staggered in a shift. We do 6 to 6, 6 to 6, and then I think it's 9 to 6 on Saturdays and Sundays. So, some are on different shifts. But so far, we've done over 100 transports combined of those 4 vehicles.
Of the 4.
Yeah.
How much pressure then have these 4 vehicles taken off your regular ridership?
There's not enough ridership for it to take any pressure off.
Okay.
We're down 80% paratransit service.
Unfortunately.
So, yeah, but our drivers, just to let you know, our drivers have delivered close to 5,000 meals for Meals on Wheels.
Mm-hmm.
They've delivered probably a little over 1,000 meals for the school program. They've delivered over 500 grocery bags for the school program. For the county food bank program, they delivered close to about 400 meals for that, for 400 meals. They delivered meals for San Ramon, that's also about 300. So between one paratransit rider, so we used to have about 500-600 riders a day. Now we're about 100-120. So when you think about, one vehicle per rider at the time, the drivers are sitting around, waiting for those calls. So we've been able to, just to let you know, we also did a contract amendment when that CARES Act, when we knew that CARES Act was coming, we did a contract amendment with our contractor, because, most of us have 53 fund funding. And so the idea of meal transport, not part of our regular funding criteria. So that allowed us to do a contract amendment, which basically now says that our contractor can do this type of services for us and we'll be able to reimburse them. So the vehicles, we have enough vehicles and we have enough drivers, even with a handful of drivers off because of their pre-existing conditions to do the service. Our biggest concern, we're also part of the BAPAC, our biggest concerns right now are, although it was our biggest concern until the surge started going up and things started shutting down again, was that as everything starts to reopen and service levels starts to increase, what is the effect of that on social distancing? And will we each have enough resources? Because, the big idea about productivity is normally 5, 7, 8 vehicle, because these are 15, 14, 15, sometimes 10 passenger vehicles that we're trying to, that we use in the service. So what is productivity going to look like? What are the resources going to look like when service levels all of a sudden jumps by 300, 400, 500 trips a day? Are you going to have the vehicles to put them in? If you're just doing maybe just 1 or 2 passengers. So that's what we're working out right now. And I hate to say this, but we've just been given a reprieve to work on these issues and come up with solutions as things are shutting down again. Because as things were picking up, the hustle of where drivers start to worry a little bit, oh, I got to get on time. But now when things are a little bit slower, you clean more, you're a little bit more conscious, you're a lot safer because you have time to think about all the things you're supposed to do. Oh, let me put my mask back on, I can breathe. Let me put my shield back on. But when trips start getting and they start increasing, then the driver's like, okay, I've got you off now, oh, I just forgot I have to put my mask on. So that little bit of a pressure, so us having the county training is going to help us build in the proper protocols. So as things go up, if we solidify those proper protocols, when we start increasing service, one will have the safety, but what we have to worry about now are the resources.
Thank you. Are we ready for another operator, or is there another operator here?
We have other operators. I don't know if anybody's volunteering to.
San Pablo's here, right?
Yes, we are.
Do you have a report?
Sure. Yeah.
Okay,
So,
great.
yeah, we're the same. Our ridership went down almost 80%. We're back up a little bit. People are venturing out a little bit more. Well, we'll see after this week, but they were before. So what we're doing is essential services. So we're doing just paratransit rides to doctor's appointments. Obviously, the big one is, oh my gosh, I just forgot the name of it.
Dialysis?
Dialysis, there we go. So dialysis is a big one. Grocery stores, and then of course banks. We have a lot of people that still, need to go to the bank and deposit their checks, and so that they can have their money. So we've been doing mostly that. I mean, a lot of our other paratransit were to our senior programs. So of course we're not running those, right? We're not running bingo and these big lunches. We are doing a twice a week delivery of senior meals. So this is the county cafe, the Contra Costa County Cafe program, which we're obviously not doing in person. So we have a pickup day, but then we have 2 different delivery days. So those have gone up I mean, we went from 50 to now we're doing about 120 a week. So that's definitely increased, and that's going to stay that way. I know the county's reporting that they're thinking of continuing to do it this way through March of next year. So, and then of course we've increased our brown bag delivery. So anybody that was getting brown bag that has concerns about making it to the brown bag, we've doubled that delivery service. So while we're not actually doing rides, we're doing a huge amount of meal service, meal delivery, which is great. And like we've said, you know, keeping them safe is really our top priority, keeping our drivers safe. So we've actually taken we saw this online, we've taken a plastic shower curtain and we've taped it up between the driver, you know, and the back of the bus, just so that when they're riding, there's a little more barrier. And we've actually gotten positive feedback from the riders that they actually appreciate that as well. Because I know, Rashida, as you were saying, we have to break that 6-foot barrier, right? When we're putting them on the wheelchair and strapping them in. And then, of course, taking their temperature and that kind of stuff, which we're still doing. We're still taking their temperature. We're doing a verbal answering, and then we're taking their temperature before we let them on the bus. So, but delivery of food is mostly what we're doing. We picked up a lot. I know Meals on Wheels in our area they had a lot of waitlisting, so we were able to pick up some of that and have them register through us and go through CC Cafe and get 5 days worth of frozen meals.
Thank you. Are there any questions on this report? Okay, thank you. Are there other operators?
I was saying I can go. El Cerrito is doing essentially the same as San Pablo. We too saw an increase in meal deliveries, and that's the main thing that our drivers are doing. We deliver about 75 to 80 meals a week, or to those households. We also are having the ride to the grocery stores, the banks, pharmacies, and dialysis. And we have seen a drop off in riders for the Easy Ride program, but we have a consistent 10 to 12 with kind of standing appointments to the grocery store. They really rely on that to get their weekly food. So we've been doing that. So there you go.
Super. Any other reports? Any other operators here? Okay, with that, what are we read? That was information. So how about now we, let's see, I think we've gotten any questions along the way. If anyone has a question on any of the operators, this is your last chance. If you want to raise your hand. Okay, not seeing any, we'll move on to reports. The first report is the Service Review Advisory Committee report, which is a report that I do. To the best of my memory, there has been no meeting this year. However, East Bay Paratransit, which is what the Service Review Advisory Committee is, the committee for that agency, which is a combination of BART and AC Transit, has been doing, in my opinion, a yeoman's job. What they at some point early on switched from noticing, I guess, that the rides were disappearing to calling riders and saying, do you need anything? And I was one of those riders. And I didn't need a ride just to like generically go somewhere. I needed food because I had no way to get food. And they were beyond great on that one. They said, what do you want? And I gave them a significant size grocery list. And they went to the grocery store and got the right brand, it was like, they did a fantastic job of enabling me to eat. And it may not sound like much, but if you don't, it's so basic and essential and they were doing, it wasn't just me that they were doing this for, they were doing this from other, you know, a number of people that they serve, that they otherwise serve. I haven't been able to get out. I think this year, because I was sick at the beginning of this year and I was in a rehab facility or the hospital for about 2 months of this year. And then after that, I came home and then we had COVID. So I haven't, even though I pride myself on my bus riding and BART riding, I haven't been on BART or a bus this year because I don't really have a way of doing that. And I've been on less than 5 paratransit rides, maybe. And it's because of the fear of being exposed to COVID-19. And there are a lot of people that are in that same situation. When I talk to friends of mine, they aren't either. So, and I even got a phone call from Kaiser about it, telling me not to do, you know, not to do all these things. So I don't have glasses that work. I don't have contacts that work. They were lost when I was in the hospital. I don't have an ID card. It was lost when I was in the hospital. And so I just, you know, I just sort of make do. Now, what has helped that I hear many people talk about, so I guess I'm kind of giving the consumer perspective in a way here, but that is what this committee report is about, is that I Zoom. And Zoom has become, I think, a godsend to people because you can be unable to get out and go anywhere, but yet you can talk and see the people that you're talking to and have a, you can, I have just as many meetings, I think, if not, I think I have more meetings sometimes. And I can do it without having to go out, without being exposed and all of that stuff. And a lot of people are doing that. And what I'm hearing consumers say when talking about, well, what do we do after the pandemic ends? And people are not at all eager to go back to being exposed to the public. They really, I think, have a lot of fear about catching the virus, and they act accordingly. I happen to live in a town that has a very low rate, at least last time I checked, like the lowest in the county of any city. And don't know if that's true right now, but even so, it's, you know, it's not worth getting exposed. And that's really what people in general think. What the bigger problem seems to be now is that there's, particularly among a certain age group, which is much younger than mine, they don't think they need to wear a mask. And the problem is that they're exposing those of us who are particularly I can't say the word, susceptible to getting the virus. So it's I think it's something of a problem from everything I've been able to detect now. All of in my city, which is El Cerrito, for the most part, our city hall is closed. All city services are closed for the most part, except essential services, police and fire, and a little bit of different departments. For example, you heard about our paratransit service. Things like that are continuing, but if it's not an essential service, we're probably closed, or people are working at home. A lot of people are working at home. So I don't have an idea when the SRIC will next actually meet, but I'm sure it will be on Zoom, because I've met at meetings of AC Transit and BART just recently for the first time, and they were both done that way. So I think that there are a lot of agencies are just now with their advisory committees are just coming online with products like Zoom. So anyway, that's my report. I don't know if there are any questions. Not hearing any. We'll move on to the Senior Mobility Action Council. Is that you, Lisa?
Hi, this is Mary.
Oh, Mary. Hi, Mary.
Hi. We've had a couple of meetings on Zoom, and there was interest in holding a town hall to get people's experiences from the larger public and also from people who are serving the public. But the next meeting, it was kind of decided to postpone that town hall until September, when we had a better idea of where we were at with the COVID virus. We canceled the July meeting because that town hall had been pushed back and because we didn't have a guest speaker. We do have a guest speaker from Uber Wave in August. And Uber Wave is that part of Uber that can take people in wheelchairs when they cannot transfer out. So I know I'm really looking forward to hearing about that. The La Miranda Spirit program, the drivers have been making calls to our clientele to ask people how they're doing, to update information, and to help them take the survey if they haven't taken the survey. We've been delivering lunches for a while. Not only did we have CC Cafe that we were delivering lunches for, but also a restaurant in Orinda was making lunches free, available for free on Fridays. And then we started collecting donations for those. Most of us have been working from home. In the last couple of weeks, people have started to return to work. I kind of like working from home, so I will probably continue with this. The way the Spirit van started with this, we were not allowed to drive anyone. So it's been difficult to get things moving again. And most of the drivers don't want to drive. Now, we don't have very many drivers anyway for our program. Our typical number is 12. But we do have 3 who are willing to grocery shop, and there were 2 that were willing to drive passengers, but that's just not enough to reopen until we can get some more people who are willing to drive at this time. But the Lafayette Community Center has been opening for childcare, and they're taking tremendous efforts in the way of sanitizing and keeping people separate and in small groups. So people have adapted, and but you know, we're certainly still in a very difficult position. I think that's it.
Thank you. Any questions from the audience or the members? Okay, thank you. Not seeing any. We'll move on. Is there any correspondence or communications from committee members? Do you want to add something to the next agenda, Peter?
Janet, I wanted to, just a communications. Mary kind of reminded me when she talked about it, the Uber Wave program. So TNCs, there's a state law in California that every TNC trip, there's a 10-cent fee that goes to the California Public Utilities Commission to increase the number of wheelchair accessible vehicles available throughout the state for TNC needs. And they collect this fee, and they're getting ready to figure out how they're going to disperse it. The state MPOs were given an opportunity to administer the program. MTC has declined administering the program, so the offer has been made to the either RTPCs that are around or the county transportation authorities, which CCTA is, and we are submitting an application to the CPUC to administer that program for Contra Costa County. So the latest figures I've seen is there's roughly $300,000 available. That's an annual number. We don't know if that number is going to stay, seeing as we have all mentioned that TNC ridership is down quite a bit. So those numbers I'm sure will come down, but I'm sure they'll probably start coming back up too as we start to get the virus situation under control. But ultimately what it will mean is that the authority will have funds to provide, and right now the program is still being put together. We have to be even approved by the CPUC to be the administrator of the program for the county. But we will be looking at programs to put more wheelchair accessible vehicles on the street and available to people. We don't know what rules there are behind those. We still need to figure that out from the CPUC, whether they have to be, same day type, similar to a TNC, or if they can be some other program. But I just wanted to give at some point we'll have more information for you and we can bring that to the PCC. But it's kind of good news because I think we'll have more control over our local program if CCTA can get that funding and disperse it throughout the county. So I just wanted to let everybody know about that since you brought it up. And at some point in the future, when we have more information on it, we can add that to the agenda.
So would that include, if it's a county program, then it brings up the issue of not all people want to travel within the county?
Yeah, it's just, so how I understand it right now, Janet, and like I said, we need to look into this more, is that we try and increase the number of wheelchair accessible vehicles for people residents of Contra Costa County when they need to get a lift. They could, when I say lift, I mean a ride, not an LY, an LIFT.
Right.
Whether I don't believe there's any rules that trip has to occur within the county in its entirety. I think it has to start within the county or end within the county. Again, that's a good point. I need to learn a little bit more about it. The project's actually the lead on this particular project is our planning director, John Hong, our new planning director, and I'm helping him out. So that's a good point. I'll look into that and see if I can get more information on what that means as far as county to county trip. And then of course, the next question I'm sure you have, Janet, is what about Alameda County? Because, there's so many trips that occur between the two counties.
Right, and some of them,
I'm trying to reach out to Alameda County Transportation Commission to find out if they are also pursuing to be they call it the AFA. I know the last A stands for administrative, but so I don't know the answer to the Alameda County.
So in West County, at this time, the only hospital is Kaiser.
Right.
So if you don't happen to be a Kaiser member, or if you need to go to Kaiser Oakland, which is frequently the case, that they don't have room at Richmond Kaiser, then you need a ride. Then what actually is a local trip for the rider becomes this inter-county trip because of the geography.
Right. No, I understand. And I suspect the rules are such that they don't discourage inter-county trips. They just want to make sure that the whole idea is to cut down on the existing response time. So their major goal is to year over year reduce the response time for having a wheelchair vehicle accessible. So it seems to flow along the same lines as the current in service.
Sorry, that's mine.
That's okay. Not enough vehicles in service to keep a small window of response time. So and then we can also potentially work with our public service providers. Like I think County Connection, you guys with your new contract have more of your contractor can provide kind of a pseudo TNC solution through Big Star or something like that. At least that's how I remember. I don't know if that's still part of the current plans, but So there's different, potential opportunities. The idea is just to get more wheelchair accessible vehicles available for people to use.
The other thing I know in West County is evening trips, because in the evening there oftentimes isn't a lot of public transit,
Right.
and yet people still have lives that they would like to live, and anyone else can get an Uber. But if you need a wheelchair, you can't go to the event. That means you can't go to a birthday party of a family member. You can't go to, any special occasion of a family member. I know East Bay Paratransit right now, the last I checked, they you have to be going to an essential service at one end of the trip or they won't give you a trip. So I can't go to my son's house, for example.
Yeah.
I have no way of getting to my son's house. And he lives in El Sobrante in West County, in the AC Transit service area. So there are a lot of issues there. Are there any other comments from anyone?
Yes, I have one.
Please.
Couple of questions, Steve, Peter. When you say wheelchair accessible, I don't want to assume that also means power wheelchairs.
It does.
Okay, all right. I didn't want to assume that. And the geographical limitations, when are they going to revisit that to expand the coverage? Because we're in no man's land out here in East County. And it would really be a problem. Well, for me, I don't have the ability now, unless I take BART, to go anywhere from here that out of the county. So are they going to revisit that those geographical boundaries?
East County's part of this. It would be a countywide program.
Oh, okay. I didn't understand that at first then.
Yeah.
Okay, that's okay. No problem. And that's the Uber Wave program.
Well, we don't know. We need to submit. It doesn't necessarily have to be Uber Wave. It can be, the concept is just to get more, how can we use this money to get more wheelchair accessible vehicles?
Okay.
People.
Okay, fantastic. Thank you.
Mm-hmm.
Is there anybody else? Yes, go ahead.
This is Mary. Elaine Welch's program cannot take wheelchairs, even though she services the whole county, which is nice. I'd really like to put in a plug for the type of program the La Miranda Spirit is, because you can set up a program with volunteers using accessible vehicles purchased through the 5310 grant program. And you can design your program to serve people like Janet Abelson, who just said she can't get to her son's house. So, there are a lot of arbitrary rules that I don't know why they even exist at this point. But, the County Connection link can take people anywhere in their service area. And they don't care whether it's the son's birthday party or whether it's a grocery store. And the La Miranda Spirit is set up along those lines, that it's a first come, first serve program.
Except for people in wheelchairs.
No,
Right?
all of our vehicles are wheelchair accessible.
Oh, I'm sorry. I thought you said they weren't.
And no, Elaine Welch's program
Oh,
can
sorry. I'm sorry.
only take foldable wheelchairs. But what I'm suggesting is that it's important to have as few rules as possible, and to have programs like the La Miranda Spirit that can take people on a first come, first serve basis. So a person like Pello can get where he needs to get to. I mean, on occasion, we've been able to put a driver and a passenger together during non-service hours, on a weekend, for example, for a special event. When I've had a willing volunteer, we could do those things. So I'm making a pitch for programs to have fewer rules so that people can get to these places that are important to them.
Thank you. Anybody else? Okay, it's about time to, somebody want, is that somebody wanting to talk? Bridget? Let's see. Are you wanting to talk, Bridget? No, okay. I think we're ready to move on and to future agenda items and then adjournment. So are there future agenda items, Peter?
Next month, MTC, Drennan Shelton wants to talk to us about, she's getting ready to update the, what do they call it? Cooperative, the federally required cooperative plan for transportation for seniors and people with disabilities. So she's gonna give a presentation to you all.
Do you mean the coordinated plan?
Coordinated plan, thank you. Cooperated, coordinated. I always mix up.
Okay, I'm sure by the time we meet, there'll be some other things too.
And
will come up.
We'll leave the operator update on COVID stuff. Just if somebody starts something new, try something new, it's interesting to hear about it.
Or stop something, that would be interesting too.
Yeah.
I hear a lot of talk among writers about what happens when things get better. There's, they're afraid to go back to their old ways of being exposed to the public. So the question is, what are we, something's got to give somewhere.
Yeah.
And it'll be interesting to see what that is. So I think we're ready for adjournment, are we not? And our next meeting is on September the 21st at 2 p.m. I would assume it will probably be on Zoom.
I hope so.
I do too. Could we do it on Zoom anyway? Okay, with that, thank you everybody for attending. I like to say attending because we are attending and we just didn't have to go anywhere. So it was good to see everybody and have a good 2 months.
Thank you all.
Thank you.
Take care. Thank you.